WHO is supporting countries and teams in the field. Before going into that, who are we? We are WHO GI Center for Health. There are 40 plus consultants and staffs working across the globe, to support geospatial data and analytics. And in partnership, we do not work alone. We kind of leverage the partnership. We work with UNICEF, IFRC, and other like Gates Foundation, Gavi, etc. And of course, the Ministry of Health at country level and other partner agency at the country level to leverage this technology for program planning. And if someone would need some support, like we do, one can send the email to this one, then definitely there will be this query will be directed to a colleague who will kind of attend your questions and try to answer it. So that's a quick introduction from our end, who we are. Now we go to the microplan. What are the applications of geospatial data and technology for microplanning? So there are clearly 5 areas. One important and first and foremost is catchment area delineation. Identifying where is your service area. That's the one of the important part. Then what are the facility or distribution centers that will be used to deliver your services. So here we are saying health facility or distribution sites or outreach session sites. So digitalizing those and using those will leverage the microplanning activity. Then another will be target population. So when we do the microplanning, most of the program manager would know how the microplanning is being done in the field. So, okay, what are the, like if it's better distribution for targeted group, let's say under 5, or ANC visit, they will kind of take, okay, last 3 years, what are the numbers? And then based on that, they just create, okay, there are 50, 50, 50. So this year also they may need 50 bed net. So that is how the planning happens. But bringing in the modeled population ground through data will help their program more to the ground, more to the reality. And another is accessibility analysis, like whether, okay, we are putting one site here, whether that is actually appropriate or easily accessible from the entire community living in the catchment area. If not, then what are the other options? So that kind of if not, if what kind of analysis also can facilitate the microplanning work. Then another is mapping also, bringing on all these information in the dashboard form or map form with help program manager to do their job efficiently for field monitoring, for program monitoring, etc. Here you can see satellite imagery, travel time. So all these I have already explained to you. And what is the process? Like, okay, this can be done. But what is the process? First is you need to know what is the ground situation. So first and foremost is microplanning base map creation. So if you do not know your catchment area, then you cannot plan. So it's 5-step process. Number 1 is identify the area of interest. Sometimes funding is not there. Sometimes some area have a good performance, may not be looked into and do the, in terms of funding constraint, You may not be able to do microplanning, geo-enabled microplanning for entire area. So first and foremost is scoping and planning. So which are the area we are going to work initially as a proof of concept or piloting or real implementation. Then second is creating base maps. Means prepare the maps of the area so that you know, based on the latest satellite data, you cannot take 10-year-old data and then create the map. So based on the latest satellite data, you need to create maps. And you can see there, like how the maps are laid out in maybe the area like this big conference room, and then you can see the workshop. GIS does not give you click of the button answer. So here, it facilitates. So you need to have a workshop, multiple workshops with all the health facility workers, ground workers together to decide what is your catchment area and where are the session sites, whether that session site is enough or not. Do we need to add more? So the third is workshop. Then field validation is really important. If you do the discussion in the meeting room, and if it doesn't, sometimes may not really shows the things on the ground, so some may not be required all field validation, but some areas you may need to choose and pick to do the field validation. And of course, then after that only you will go to GIS softwares. So step number 4 comes only after field validation. You can do digitalization. And then you can prepare in the map form, dashboards, interactive dashboard for program managers, planning. Okay, so these are the 5-step process. Some experience. This is one of the country where we were involved. So it was for polio campaign, house-to-house polio campaign monitoring or implementation and monitoring. So we kind of invited all the health workers. Like they have been doing OPV campaign for like many years. However, there has been recent outbreaks, so we were called to support their microplanning work. Then based on our discussion, they said they know their area. You can see on the image on the right side, you can see multiple white boxes. So what are those? Those are, they're saying, okay, this is my catchment area, and individual box shows how many, day 1 plan, day 2 plan, day 2 plan for team 1, sub-team, how do you say, sub-team, 1, sub-team 2. So it sounds very interesting. Okay, whatever they are thinking, they put it on the paper. Now, when we asked, go with your mobile phone, use very simple tool, walk along the area. We don't need day 1, day 2 demarcation. We just want your catchment area demarcation. And they did walk. And you can see the yellow push buttons. Those are the GPS point they share. And then the area they said they are covering, actually in reality, you can see the difference between their perception and the area they are going. So it's house-to-house campaign, and you can imagine for this single group, single catchment area, you can see how many households been not covered, like, the white boxes. And there may be like some areas goes beyond the white boxes. So maybe there is overlap with other teams. So that is the main objective of having digital microplan, to know your area very well. So that is how, field validation also, we did to refine their catchment area, and then for campaign purposes. And how many of you are in malaria program? I think many of you are doing. So and then in your experience while doing microplan, what do you think most toughest of your, thing that you see or challenge, one of the difficult area or challenge you see in microplanning work? Any volunteer? While doing microplanning, okay.
What is the most challenging part of doing a microplan? Forget about what we have just discussed, but in your area of work, with your organization, as you've been doing this from time to time, what is the most challenging thing you encounter when doing microplan? Do we have some, you all do distributions?
Yes,
we have.
So getting an accurate picture of where the population is, right? So getting accurate population numbers, accurate census where there are populations that move. So in areas of conflict, if during the day they come back into the community, during the night they leave the community, all that stuff. It's very, very complex the further out you get. And as the needs are heightened, as the population is more vulnerable, the complexity increases.
the same.
Yeah, we have, they say I should be running around, so.
Yeah. I think maybe just on top of what Jason said, also where there's conflict and people have moved or are moving, how do you actually determine the population? For example, using the case of, say, Sudan as an example, how do you determine the population within that geographic area where people are moving on a daily basis? So that is one of the key challenges as well. Yep.
Okay, so conflict, population, determining the population because people are moving. Any other, I'm sure we don't all work in those settings. Some people work in, but those are very valid.
Okay, I think for me also it's getting to know which areas are urban and which ones are rural.
All right? Getting the lay of the land.
And so the data that you're given is out of date, thank you. So out of date or uncollected census data or data that you're given that isn't accurate.
Great. Denominator, yes.
So when it's a rainy season, a lot of the roads that you do have are blocked, are overflooded and so on. So knowing how to get to these people and how to actually get the services that they need to where they are would be a big problem as well.
Accessibility, yes, we have that.
So this is maybe in a different vein, but thinking about when I've done microplanning, one of the key issues often was finding places to meet that have electricity and finding, especially now if we have resource constraints and we don't want to be paying for venues. So one of my questions is in terms of developing these maps and the printing and the disconnect between if we're meeting in classrooms that are decommissioned when students are not there, even trying to find benches and bringing in extension cords and things like that. So how do we manage that with then needing to have these kind of fancy printouts and, how do we manage that on the operations side? Yeah.
Okay. So I think the disconnect between things like you picking a location where you have, whether it's electricity or, the different services that we need to, when we talk of digital, of course, it doesn't happen. It happened within a space where electricity has to be consumed and so on. Network, internet, and all that. Great. So that's definitely a challenge. Maybe one last one, and then we can proceed. Okay. I think looking at all this, one of the recurring thing is, can someone just in one word, the most recurring thing that appears there, that we see on all the suggestions and challenges that were made? I think we can all agree it is a question of denominator, right? Your population, getting the accurate population, because before you even decide where you should do what you should, one of the things is, where is my population and how many are they? So when we talk of one of the key challenges in microplanning, we're talking of estimating, it won't be as accurate, but it is how do we make it as accurate as possible to be able to plan, given the current situation, of course, that we're in, where resources are dwindling and yet you still have to meet targets. But of course, all the other things definitely apply, given the context. And it's just good we want to ground-proof this in reality of what you guys go through and what we all go through. And that's why the next session is also going to answer some of those, and some of them will come as we do the practical aspect, the electricity issues, picking where and who, and so on. Mona, please proceed. Thanks.
Thanks, Sam. So basically, what are the main challenge is population, urban and rural land use, and accessibility. So that's what we got, challenges from that group today. So all these can be derived or from satellite data, and some ground truth information. So all these can be modeled. So for that, you have satellite data, now the higher resolution satellite data are available. So you can look at up to building level. So you can extract building footprints. Based on that also you can roughly estimate what is the size of the population. Not direct population count, we are not saying replacing the census, but we are saying at least we know the rough count. Okay, in my population catchment area we have 500 household or buildings. I wouldn't say household. There is difference between household and buildings. So that way we can have an indirect approach to get information of population residing in that catchment area. Similarly, there are WorldPop, there are Meta, there are other grid, various population model raster data is available. Once you have accurate catchment area. That's why we are focusing catchment area from first minute. Once you have accurate catchment area or delineation, then you can use satellite data or modeled raster data sets to derive most of the denominator from it. So this is what this slide is.
Mona, if you can go one back again a bit. So, especially, there was a specific request from someone outside, especially on when we do campaigns we go to the field, we capture GPS coordinates, of, the locations we have visited. And then, you come back, probably you've done thousands and thousands of this. You come back, you upload and to see, okay, what are these, because now you're trying to plan for the next campaign. And then all of a sudden, thousands of GPS coordinates are you're in Nigeria, some of them are in Kenya, some of them are in South Africa, and there are thousands of them, yeah? So this is not something alien, you experience it from time to time. And one of the things that we are now utilizing is the building footprints. So as she mentioned, with high resolution satellite, you're able to really extract detailed and updated building footprints. You pick the points, yeah? So even before the guys go to the field, you front load all those onto your device. So as they do their campaigns and all that, they're really just validating that I've visited this, check, as long as it falls within the area that you're talking about, such that you really, whenever any new buildings that are detected, they then can capture that. But most of them with high resolution satellite, which is really up to date, you will already know that there are actually households here, go there, and just validate that they actually exist. And this is then sent back, because when you submit the information, you visited this, you visited that, you missed this, you missed that. But with a front load of all that, you save a lot of time, and also you get to have accurate data and not rely on the inaccuracies that we get from phone devices going to capture this data. So I just wanted to emphasize that.
And then most of the time, what everyone thinks, everyone means including us, once we do the microplan, due enablement, then all the problem will be solved. That's not really true. So this particular diagram shows the first part is geo-enabled microplan, which includes data, tools, and methodologies. Okay, we have a nice maps. Then what? We need to build capacity at local level or country level. We need field validation. We need regular update. We need IT infrastructure. And also we need ownership and use of the work in program planning. If these two are not synergized or doesn't go hand in hand, whatever we do, it will be a piece of art in the museum. So what is, for us, digital microplan is you have geospatial domain, you have program domain. Unless program domain does not go hand in hand with geospatial domain, digital microplan is never complete. Yeah, you can get maps, you can get outputs, but actually the objective is not fulfilled. So that is what is very important to know for all the program managers. And what is the key benefit? Since everyone asked, have experience in microplanning. So with geo-enable means, there will be enhanced efficiency, means everything will be available online. You know catchment area, you know what is the population, and then planning will be easier and faster. Improved coverage. Once the planning is efficient, then coverage will be improved, reach will be improved. In addition, you can do, like Sam said, you can do, here it was for monitoring purpose. You can use these data, like you send the team in the field, and hey, go, what is the LLIN coverage in the hard-to-reach area? Go to this building and see what is the coverage and where are these gaps. And you can really look at on the monitoring results near real time and see, okay, this area, the coverage is not that great. I mean, like, this population did not go and get the LLIN from the distribution center, so we may need to increase the communication, I mean, for those community, or maybe add one booth over there to cater them, or yeah, so there are, like, it gives a tool for you to visualize what's happening on the ground without you being needed to be in the ground. So that's the what it says. And just to know that all these techniques and methodology already documented. There is a handbook available online, plus we are working on e-learning course, so that this is available to at country level or the experts that are interested in doing microplanning, geo-enabled microplanning. Another domain we are approaching, another area we are focusing is one campaign management tool. Microplanning mostly done during pre-campaign phase, mostly for resource estimation, to mobilize the team, to do the better campaign planning. But planning doesn't mean that the implementation will be good. So what we are thinking is end-to-end solution, the entire range of phase of campaign, like pre-campaign, post-campaign, and intra-campaign. Intra-campaign, you can do monitoring. You can look at the microplan and see, okay, where needs to be added one more sites. Or you can do whether the teams doing the monitoring, evaluating the coverage. And then post-campaign also look at what is the impact of this particular campaign. You can do that. So this entire one campaign management tool, we are kind of trying to bring end-to-end solution in single platform. That is covering entire phases of campaign. And also another area we are trying to build is many geo-enablement is not single workflow. Like you have monitoring, you have accessibility, you have microplanning, you have different software. So when the audience or the key country program manager looks into the microplanning tool, then he looks at, okay, I want to use this component. I want to use accessibility component and a microplanning component. Or I want to use, I want to use survey one, some kind of monitoring to look at the distribution status. So they can just plug and pull the, in that particular infrastructure system, and then also simultaneously calculate the resource estimation, etc. So that is where we are moving further. And now, this is the countries that we are, WJ is supporting for microplanning. And then one here is mostly, most interesting one is Bangladesh. It's currently almost at the last phase. Initially, like other countries, they started with 2 pilot districts, and they tested the usability, etc. And within 1 year, they kind of scaled up to entire country. And Bangladesh, you may know, it's one of the most populous country. And so it's happening. It's WHO, along with UNICEF at country level, and Ministry of Health, with the support of GIS Center headquarters. We are finishing this work. So this is quite interesting, commendable work in Bangladesh is doing.
Just to, again, Bangladesh stands out because it's also a model of, most times when we learn new things like this, the first instinct is to go and say, oh, we're going to roll this out into the entire country, yeah? And from experience, we know that that will definitely not work. And so the pilot phase, because we just picked 2 upazilas to just test. Again, because the most buy-in, the challenge is, technology is not a challenge. It's always the human component, the program domain that always challenges us. And so unless you can really, at a really micro level, pick and pilot this, you will definitely get pushback, because the immediate thing is you will fail, and then all that is going to be shut down. So the message here is, as we go back, when we finish all this and we try and think how to do this, let's think very small, but plan big, and also start very small to prove and get buy-in before we try and eat the whole elephant, as they say. Thanks.
Okay, so some important slides from Bangladesh experience. So this is from health workers' perspective. It's not from program manager coming from higher end. So if you can see, less active monitoring practice. When they did sit in the group, looked at the images and found some gaps and weaknesses, and they found that because their monitoring is not there, enough monitoring is not there in the ground, because these found various gaps in catchment area, in their session sites, etc. So number one is that. Then, and another they found is issues in session site distribution. So as you say, okay, I have a session here, so it will cover entire table. May not be right. So that's what they found. Another is, like, now they say, okay, now what we need to do increase the monitoring activity or improve the monitoring activity, they do not have digital, real-time data anywhere. It's on someone's paper. It's not there anymore on the, digital form, or it's shared across the level. So then there they found the need of digitalization there itself. And without geo-enablement, they couldn't find how to reach areas. And also, normally, this is for immunization, but microplan can have, like, the microplan that is happen in immunization field can be used for malaria, can be used for another, because they will be using, if it's fixed site, they will be using, what do you call the ANC visit sites or immunization session sites. So the microplanning still works only. So normally the process is copy and paste. They haven't invented any new. They have been making this microphone last 10 years. Okay, I have 10 sites in this area. This is this place. So they never really did the critical thinking. That's what, these are the findings. And you see, like, maybe a bit difficult to read. Like, this is a catchment area. Within the catchment area, they have delineated sub-catchment, and they also identified where are the session sites happening, whose house is it, or which place is it. So it's this is the workshop which kind of helped them to develop this. And also, in this area, like if you see before microplanning, you could see only in one site. But then after discussion in microplan, they said, okay, this may not be enough for catering entire population. So let's have another site, the green dots. So that's how GIS helped them to identify new innovative way of reaching the additional people. And someone mentioned like accessibility or do not know the movement. Like you can see this normally is, you see, what you see in the green box is some rows of housing. So what they says is from vaccinator perspective, he or she wasn't aware of these new developments. So these people were missed out from their regular planning. So this is some of the examples that helped to improve their micro-planning and then their planning process. Okay, so now anyone?
Yeah. So if there are any questions on this, again, most of the things is not new to many of you, just in the context of what we're talking about, but the aspect of the geo-enablement may be very new. And so it would be good to, if there are any, because we're going to now move into the practical session, and so if there are any questions that you kind of thinking of from the discussion that we're having right now, this would be a good time, or forever hold your silence.
Hi. This may be a very, very silly question, but like if you look at the example for Bangladesh, the microplanning was done, and then in the workshops you identified gaps, and then in the last slide you kind of showed that there's an area with homeless people, which was then recognized through using the GIS information as well. But then, like once you identified that there's a gap in homeless people and that you need an additional site, how did you then know in detail in that area what the actual need was? Because you've seen it like from the GIS data at a higher level, but then did people have to go back into that area to identify the real gap there? Like how does it work, that next step to understand in more detail that specific area, what the requirement is?
So thanks. If you can just go back to that slide, I think gives context. So again, the green area, which we used, as you mentioned, we can see it from whatever office or in the workshop that, there is a new settlement here that we didn't, probably in the previous campaign, it wasn't there, yeah? And remember this moment of saying, it's only happening because you're now using GIS to do that. Because if you were to do the copy and paste of, okay, let's get this area, okay, last time we distributed this, let's do the same thing. These are the homes, yeah? Because when you're walking on the ground, even if something is 100 kilometers away, you would not know unless you really have that view from up. So the next step really is, yes, you get that realization that there are more settlements now. We need to increase probably the number. And one of the things that was mentioned on, which is estimating the population, that of course now translate into the next step, which is we need to increase the number of bed nets that we have to be distributed in this area. So that is really only happening because there's that aha moment of now we see this, now last year we used 50, we see now maybe 500 buildings, so let's add more 500 bed nets or whatever it is to the last year's planning. So it's still, you're really just improving based on just new knowledge that you acquired in the resource estimation, which is also part of the session of the practical, where we will use, actually, it's not just we're sitting looking at satellites, okay, good. You know, we are going to really use this to see how this translates into calculating number of bales that you should, you know, because of the number of population you have determined and all that, yeah? Any other burning ones? All right, silence is good. So for the next session, I don't know who the time, you're the time, Robert, you're the timekeeper? We still continue? Okay. So the next session, as we said, this is a practical session on data analysis for malaria prevention, but it's really what we're trying to reinforce as program managers and in your area of work is thinking spatially in your activities that you will be doing going forward. And so we had asked you previously if you could install QGIS on your laptops, but we are going to really divide into 3 big groups because we have, anyway, we have more maps, but there are 3 separate areas. But if 3 is too big to be in, then we can have the similar maps distributed into other groups. But for now, if we can distribute ourselves into 3 big groups, and then we can have other groups again if it's too big to accommodate. So, and of course, try and be, if you don't have a QGIS software installed, be somewhere where someone has. Yes. Okay, so let's try 4 or 5 groups, just so. All right, let me use some executive power to move people around. Yeah, so since you're a bit few, if you can maybe join this group. I'm starting with my good backbenchers here. So you can join this group. Yeah, I want about. Thank you very much. So, but I think that may still be much. So let's try and just maybe come a bit, because we're going to give you maps and we are going to really go into it. Yeah. So that's why, if we can even make it a bit more groups, that would be great. So send one. Once you have combined, send one person to come and pick a satellite map.
So how many groups are we now?
Don't pull the tables. Just leave the table. Just join a table, because there's so many IT infrastructure underneath. Yeah. So if you pull, the lights will go off. All right. Just be generous. Accommodate new friends. Yeah.
We go pick out a map. Okay, Sam, quick.
So you're in this group, yeah? Yeah, just, yeah, pick this one. This one, yeah.
Look at these big, beautiful maps.
Which group are you in? So I need one, so one group has picked. So there's a group here. I need one more group to come. We still have. So this group, can you send someone to just pick? Each group that you've formed, you need one of these. Yeah, just join this group. It's fine. We will further split, but for now, let's make 4 groups. Pick this.
Oh, just 4 groups.
Yeah, it's okay. Pick. We will.
Does it matter which one? We want to pick one of these.
Yeah, just pick. It's fine.
Oh, very nice.
Hmm? Yeah, just give to.
This guy's name. One of those groups.
Yeah. How many have maps in a group at least?
So, where's my group?
You can form a group here. Here, come here. Here, you sit here. These guys have left, I think. There are guys who have left, so come here. No, come here. I can't move the ladies. I've moved them twice already. So, gentlemen, come here. Yeah. Because I'd moved them already, so. So if any group is too big, we have one more. If any group is too big, we can split it into two. We have one more. It's for groups, so you have to be in a group. It's not for individual. At least make sure in your group someone has QGIS software installed. Otherwise you will be admiring the maps and not doing anything. It's fine, it's really fine, but at least one should have, make sure at least in your group someone has a QGIS software. There is a, good. There's a marker here. Anyway, I'm sure, does someone have QGIS here? Great, excellent. Anyone has QGIS installed on their laptop in this group? Great. So if you're too many in a group, you can move. I see there's still seats here, so some people can join. You guys have a QGIS software, right? Yeah. Great, excellent. All right. Marker. Here, have this. Do you have a marker? Here's your marker. This is for the
facility.
Yeah. These are markers, so I'll just.
That's for catchment.
Yeah, the blue ones. You've given this for catchment, eh? Or you haven't given them?
No, I gave the marker.
Ah, okay. Continue giving. All right. Let's share this. So have that. You won't need them all, so I'm just going to split it. I'll come for this later. Make sure you have a marker. You have, sorry, that's very inappropriate. Yeah. Okay. There you go. Did you get one of them? It's fine.
So,
okay.
so we have how many groups? 6 groups, no? Group A, Group B,
Group B,
C, D, Group D, A, great. So we have 5 groups.
yeah. So we have, I think we have done at least one. Groups have been formed, one laptop per group, satellite maps. So at the end of this session, again, you'll be given at least a problem will be provided, and you'll be asked to solve that problem and present, one or two groups will be asked to present what they found. But again, as we mentioned at the beginning, this is not a QGIS or GIS training. So whatever you're doing is really, think of our hand-drawn paper maps that we have always been using in the community. We are transferring that thinking into a digital, a more real-world aspect of it. That's why you have the satellite image, yeah? And also gives you more grounding in what you're doing and not, I know, and it's not, data is not saying the same thing. So if you can move to the next step. So as I said, make sure at least someone has a software. There's some data that will be, Robert is going to confirm, but we will provide you with that. So before we even start thinking of what we have all been talking about and why we are here, which is bednet distribution, you know, and so on and so forth. One of the first things is really identifying where the problem is, because you're not just going to distribute all over the country because of, as we say, resources. So what we always do in the different areas is we first look at really for malaria incidents, the change that has happened or the percentage change that has happened. So this map that you show is an example, which is based on data from Malaria Atlas project, which is, everyone knows that since you work in the malaria program. So we really took data from 2016 and 2022 on malaria incidents. And we just really did an analysis to see the change in malaria incidents over the in the 2 years of 2016 and 2022. So what I'm trying to say here is you've been distributing nets. Okay. Yeah, you've been distributing nets from 2016, or you've been doing interventions from 2016, and now you're in 2022, yeah? You really want to really see, is this thing doing anything, yeah? Or the numbers we always, when we present, always in the first part of the AMP meeting, we present trends in malaria, you know, how things are happening globally. So when we look at really at a micro level of a country, we also want to see if whatever interventions you've been doing can be the mixed approach, the targeted approach, and so you want to have a feel of what is really happening in the country. So from the map, which is a very simple one, is really showing what has happened, the percentage change in malaria incidents across in 2 different years. And from what you see, the dark shade is really showing us that over the course of the 2 years, your interventions, cases have really, you know, the change, the percentage change has just increased. It has just increased, really. But the areas that seem to be working, what is working, it seems to be working around, you know, the lighter blue areas, yeah? And so this really, even before you go into these massive, you know, thoughts of how do I do this, really helps you prioritize where to go, which people target, and so on. And that's why, for this particular slide, it's the first one, because that's where we make the decision on where to go in a climate where we have very limited resources. Yes. Okay. Percentage change. Yeah, so it's showing percentage change. So for 2 different years, so the data on malaria incidents in 2016, aggregated, and then the one on 2022, and then we just calculated the percentage change by district or sub-district, yeah. And then that map came up. Okay, so the key thing here really is, as I said, we are not going to teach GIS or give a lecture on GIS, but really is an interactive session where we are going to translate what we usually do in the field onto this, and then we are going to digitize what we have done on that into a QGIS environment or a digital environment. So some of the things like, how do I do this? What is this? So most of the questions will not be related to the software itself, but will be to the program areas of work that you will be, that you currently used to doing. Some import and visualization and overlaying different layers, you know. So these are just at programmatic areas. Next. Maybe I have to be there. Yeah, so these are the satellite maps that you have. So in a normal, remember our 5 steps? Do you still remember the 5 steps when we are doing a digital microplan? What is the first one? From group A. Do you still remember? Uh-huh. Scoping. No, in the scoping, right? Yeah. So in banking, say know your client. Yeah? So it's the same, like know your area. Yeah, know your area where you're going to work with, and that's why that is usually the first step that we go. The second step, group B. Among the 5 steps, do we still remember? Base maps. Base maps. Yeah. So we have the base maps. Now the third step, which is what we are really going to do now, group C, E, D. Do we still remember the steps, the 5 steps? Pardon? The workshop. Yeah? So this is the workshop. So again, it's a simulation. It's something that you're really in the community, you're doing with the community, but this time you're introducing an element of some truth in what you're doing. It's not based on, of course, the local knowledge is still very relevant, but if the satellite map says there's a house here and someone's saying, no, there's no house here, you know, so this is where these questions now start getting answered, and people in the field, health workers in the field start seeing that the different challenges that they used to face in the conventional microplanning, and this is where this discussion happens, and that's why this is the core of what we are going to do today. Next. Yes. Okay. Okay, so the next thing we are going to do now, in your areas, some of the maps are the same, but 3 of them are unique, yeah? So I want you in your group, think of that base map has a catchment area, a big catchment area, and let's say 1 supervision area. You can think of it, but think of that as an area you're going to plan, you're trying to plan your intervention in. And using your own discussion, you know, these are the things I need you to do. With your marker pen, discuss within the group. We have this area that we have to, whatever strategy you think of. Yeah, is it a fixed site strategy? Is it a door-to-door or mixed approach and all this? I want you to discuss on where you're going to distribute your teams. So your program managers, you're planning for the next campaign. This is the area you're supposed to cover. There are buildings there, that means there are people there. But you want to split the area and divide it among your teams. So using the marker pens we have provided, discuss within the team and see how you can divide the area in such a way, of course you're thinking, in such a way that when we divide the area, there will be good coverage, we will not overtire our teams, you know, teams are equally distributed or it's distributed proportionally. Yeah, so those are things that you will be doing practically. So in your own group, that's the first step. So that is delineating, drawing your team area, and you can decide to use, in your area, you're going to deploy 5 teams. So that means you have to divide. How you divide it is really up to you. you decide how you're dividing that area. And then you're going to also use these stickers. So the stickers you've been given, in each area you've drawn with the marker pen, label it, this is which team. This is team A is going to go to this area. Team B is going to cover, you can give them names. Team Renzori is going here. Team Nairobi is going here. You're really planning for the next campaign. So get in the zone of an actual planning that you're doing, how you usually do it. So discuss within your group why you're choosing this particular area and decide, okay, if you all agree, let's use this as our first team area. Then you split the entire area. The next thing you're going to also do, yes, we see a question.
What is the team trying to achieve? Like for each area, are they going to register that households, or what are they going to do?
Again, right now we are planning for the next campaign, right? So this is, let's say, whatever district that you're planning the campaign in, yeah? And in this district, you have a number of teams that we use. So you can, because the first is just distributing the area in a way that you feel, okay, let's say we're going to say from here up to here is going to be covered by, we're going to deploy a team in this area. And that team, consisting of maybe 5, 10 people, depending on the number, is going to cover this. If it's door to door, that means they will be covering all these, they'll visit all these households. And also plan on, if we are also going to use the fixed site approach, where are we going to put the fixed site? So decide on the map, find a location and you should discuss why are you putting it here and not here? Why are you choosing this building and not that? Because these are actual decisions that you need to make, such that when you now deploy your teams, they really, they know what they're doing, yeah? So you're going to identify areas, discuss how you're going to split the district that you have or the map among the teams that you're going to deploy. Choose which fixed sites, where are you going to put the fixed site in each of the delineated area you've drawn with the marker. So the stickers will come in handy. Whatever you write on the sticker, we are going to translate what you've written on the map onto a GIS environment, and then we do some analysis inside there. And then we do estimation of population, of what resources is required. Are we together? Yes.
So what we are thinking is, it's whichever campaign you use it, you need to do micro-planning. So here what we are thinking is we are trying to get the universal coverage. And we don't think about how many percentage being covered in which campaign or etc. But we need to know, like, okay, first we need to know what is the area we are targeting. And you need to know how many population in that area will be. Number 3, then you can see to cater that population, let's say in single phase, 10 days, you are distributing in fixed site. So will that strategy, setting up one site is enough in this area, or you need to set up 2 sites? So like that, I mean, you can kind of devise, I mean, based on your experience, scenario, and then at the end of the exercise, there are some people having a same area working, so, and you may need to explain why do you think you are having 4 sub-catchment and 4 sites, why? So just to, like, normally when we do micro-planning, it's table exercise without anything on the ground based on the local knowledge, but with the map, you see additional information. So that you need to use to devise a strategy. That's what this exercise is doing.
Thank you. No, I think it's clear. I don't see movement on this table. You have already finished, or? That is a decision you have to make. So think of your usual micro-planning. Imagine I've removed this map away. when you're doing your micro-planning, what do you usually do? Last campaign we did in this area, it's an Excel sheet, no? In this district, these are the number of population, number of data, it's an Excel sheet. But remember, what we are trying to, one of the biggest challenges, population estimating, first of all, where are the people really? Yeah? Are the numbers really matching with the ground reality? Are we achieving universal coverage? Yeah? And that's why satellite maps come in. Because Excel will not tell you, if you put there, this name is, it will not tell you where the household is. It will not even tell you where to go. Yeah? And that's why now we introduce something which is more real, compared to local knowledge of the LC1, the local council, or I'm the supervisor. I've been there 1,000 times. I know my area. But you may find this whole block was being missed because no one thought that there were new constructions that were happening here over, and because it's not something you didn't know. If you don't see it, you don't know it's there. You only know what you know. Yeah. So, as we said, divide the area, discuss among yourselves. This is our area. This is how we're going to divide our area. It's divide and conquer. We want to ensure universal coverage. Everyone here is going to be rich. So the strategy you choose will be things where, okay, there's a door-to-door approach. We're going to use fixed sites, so you have to identify where are we going to put the fixed site in each block that we are going to choose. And you discuss why are we putting it there. Do we need one for that? Or we need two? Why are we putting two? And where should we put? If we are saying two, are we putting one here, or we're putting one here and one there, and So these are decisions that you're actually making based on what is on the ground. Because when you go to the field, you'll actually find there's a house there, or there's a health facility there, or there's a school there of what you've decided.
Yeah, what's our resource limit? Is there like a cap? He said, don't use mine. Since when you were talking. Oh, sorry. I'm new to this, but I'm asking, is there a cap on the number of sites?
There is no cap. So again, it's a decision based on the area. So it's like, if I'm covering the whole of... Colleagues, feel free to walk out and, grab tea or something as we go through this. It's a working break, so feel free to walk out and pick something to snack on.
We have 2-3 minutes more. We can go up to 5 minutes. So we need to end the exercise by 10:40. Sorry, 10:50.
Telling them to go whenever you can go. Colleagues, feel free to go out, grab something to eat, and then you come. I know it's very engaging, but let's keep the central government happy.
Which city is this, by the way? We were wondering.
Burundi. This is Burundi. This is Burundi. Yeah. So the satellite maps you're working with is Burundi.
So we start from 11.
Colleagues, we have 10 minutes to finish this paper exercise. So use this time to go out, grab something to eat, come back. Because at exactly 11, we are going to start transferring what you have digitized, what you have drawn into a digital environment. So.
And also ensure that at least one of the group has QGIS in their machine, in his or her machine, and also download the data from Google Drive. We are starting next session by 11.
5 minutes to go. Go for a break. Come back. But every map should have lines drawn on a marker on them, because that's the first thing we're going to do after, to digitize it. Please make sure your satellite map has markers on it, because those marker lines is what we are going to digitize. So if you don't have that, the next step will not translate into anything useful.
Are we ready to go to next session? The next session requires QGIS. So the 5 groups, no one is here. So could you please ask everyone to come to in groups? Hello. Are we ready? Are we ready? Excuse me. We are starting. I think everyone needs some bit of exercise. GIS group. So can everyone please stick to the same group? We are not changing table. And please ensure that at least one has QGIS. I think no one has QGIS, so I will just, is it?
You don't need to go through the slides, no? Because we are just really digitizing, so you're just going to...
No, I mean, I just was scanning. That's why. Yeah, it's already there. Hello. Attention, please. If the session is delayed, then we won't be able to cover all the areas. So I'm starting. So colleagues, can we open QGIS? Anybody has questions for earlier session? How do you find this catchment area demarcation? So QGIS, please open your QGIS. Everyone, can we stand? Can we stand, all of us, once? Just to ensure that we all are in same room. Just stand. Everyone, please stand for one few seconds just to get attention. So, like, we still have some busy with the work. Okay, just to ensure that we all are in the same room. Okay, that's pretty good. Now, how do you find this delineation work? How different it is compared to your normal microplanning or planning work? So that is question to be answered later. So now, how many steps we said for microplanning? Yes, that's the spirit. Okay, so 5 steps. So we have completed 1, scoping, 2, 3. Now what is the 4th step? Digitalization and partly field validation, which we are not doing field validation, but now we are going to okay, so each group has QGIS. One person can do that. You don't need to ensure that you need to follow the whatever area you have delineated, but ensure at least one polygon is digitized. Just to see what is the digitalization process is. Like now you have discussed how many catchment area or how many teams you are going to deploy in your catchment area. Where will be the distribution center? So there are 2 layers we clearly see need to be digitalized. Why? To make sure that it is available for future work and can be accessed by not only by you or the one on the ground, but those who are in the office or somewhere else. So that's why we are going to digitalize the data. And then based on the digitalization, we are doing further analysis also. So please sit. Sorry to keep you waiting. So who has QGIS in this group? Okay, you can. QGIS, you have. QGIS, maybe this table. So we have QGIS in every table, no? Now we are starting. So have you downloaded the data? I asked everyone to download data from Google Drive. So have you downloaded data from here?
Can we confirm we have the data?
Right now you can download Burundi malaria.
Let's just download it. We will sort those small things out. Just make sure you have the data. I know when you try to open it, it's going to give you some whatever, but don't worry, we are going to... I think it was sent in an email to the participants who registered for this session. Because it's a... I don't know. Ah, it's a,
You got it? So now,
Which file are we downloading?
so download the one that is called Geo-Enabled Micro-Planning, AMP meeting. Yeah. So you only need preferably one laptop, yeah, with QGIS, such that at least we, again, it's a participatory mapping approach. In the field, not everyone is sitting and doing their own thing. So that is what we are trying to encourage. And you will meet people from all across the area. So it's part of the process. Let's choose one person to do that, and then we can always, yeah?
so, okay. Now what I'm doing is like, you have discussed what is the catchment area, how many teams to be deployed, and then where should be the distribution points. So how do we digitalize this? You go to QGIS, layer. Just before going to QGIS, make sure that this Burundi malaria. So, I mean, table A, table B, table C. Everyone has data, D and E, data is already there. So how are you going to digitalize the data? First, follow me. You are not getting hands-on. Follow me. Can you see this XYZ tiles? New connection.
Colleagues who are going to be doing the digitizing, please pay attention now, because this step is very important. Without this, then we will not be able to digitize anything. So we are loading the satellite imagery, what you have just drawn on. So if you are part of the group that is going to digitize for your team, pay attention, because you have to do this afterwards for your team. Then we start digitizing.
So, do you have access to presentation? Okay, go to slide number 23. And there, under point number 3, you can see a link, HTTPS, etc., etc. So copy that one. Copy entire. Copy. Then paste it here. So my link is AMP workshop image. I have many, so I just want to make sure that this is okay. So you can see in XYZ layer, I could get the AMP image.
Can we have a show of hands, those who are able to have this appear for their team? It's not everyone, just your team member who is digitizing. We are still bringing in the satellite image. So the step that they just did is to bring in the satellite image, because it's the same satellite image that you have been drawing on. So it's what we are going to use for digitizing.
And we have,
Thanks,
yes? Okay, good. Everyone, are we good? Now what we are going to do is, now we are trying to import a layer, set of layer, so that you can work on it. We have already prepared most of the thing, like we have created empty layer. So for that, go to add layer, add vector layer, then navigate to the folder I mentioned, Burundi, malaria, something, something. And there will be the file with extension GPKG. It's a geo package, which is a file format native to QGIS. It's a data package. Just click that, open, and add. Once you say add, it's automatically select all layers been done, add layer. Okay? So maybe there are multiple layers being added on the top of your image, earlier image. Yes? Sorry? Okay. So for that, you go to layer, add vector layer. Then go to the folder with the geo package file stored and open. So you will see 1, 2, 3, 4, 5, 6 layers being added on the top of your imagery. So what I will say is zoom to the layer. Go to one of the 6 layers, anyone, and say zoom to the layer. So it should point to the area where you have. And this image corresponds to the image that you worked. So normally, and we have kind of developed a footprint. Okay. So this is the area from where you got pieces. Like this is the entire block. And this is one of the piece actually. Can you see this? Can you see this? The second last, second from the top, the layer catchment area. This is just to guide you where is the place that you worked. And then once you identify, based on today's discussion, based on morning session, how did you demarcate the catchment area? So you need to follow that line and create a polygon. I mean, follow the road. Mostly, most of you followed the road network to demarcate the area. So just to show you how to digitize a polygon. For there, can you go to the second last layer? Empty team catchment area. This is empty file already created for you. Then we are going to digitalize the catchment area or adding the polygon in this empty catchment layer. So there is a pencil you can see. Yeah, toggle editing. Can you see that? Once it's done, there is add polygon feature. If you click it, and then for GIS you need a mouse. If you use the computer mouse, then sometimes it's difficult to follow the route. Let's say for me, I'm saying the area that I'm dividing is the you know, the brown layer. Someone was saying this is the school. I think one of you was discussing about setting up a center here or not, or adding here. So let's say my catchment area is, let's say from this point, I will kind of better? Okay. Because sometimes it's difficult value to do. So then when you reach to an intersection, when you need a turn, let's say, then you need again press a click, and this area is going in this way, then click and click, click, and once you end, right click. So have you seen that? This means the feature has the polygon digitalization is done. So this is one catchment area. And go to a field just to name the, like you need to know what is this area. So there okay, here what I will put is alternative name. I'm looking for, yeah, this admin2 alternative name here. This is the field name. I will not explain what is there behind. This is just like how do we digitalize. So here we will put supervisor.
Colleagues, just like any new tool, when they're doing it for the first time, just watch. Yeah?
Supervisor area.
Just watch, and then when we do the second time, that's when now you start doing it. Because if you try to go at the same pace, listening, trying to do it, you will get lost completely. So first take, just watch what she's doing, where she went, and then the next repeat, now you try to do it. Then the third one is now where we try to refine for people who are really, really lost. Yeah? So I know it's tempting to always try and do, she's been doing it for 20 years, so so just be patient. You will get to that point where you are able to digitize it faster. But she'll also go slowly, so just watch for now. And then when we say start digitizing, then you start doing it.
Yeah. So can you see that? So this is how we do, and then do not forget to save your data. So we just, tool is so intuitive, and it's open source. You don't need to pay license or anything. You can download and install. So save. Okay. So this is how we change paper-based catchment area into digital form. This should not be one-time event. This should be recurring every year, like normal microplanning process you're doing. This geo-enablement or this exercise needs to be done every year to keep updated. Like in Bangladesh, you have seen, like from the satellite, suddenly there were new settlement like around IDPs appeared within like few months. So just to ensure that your plan is up to date, this is recurrent process, and this is how we digitalize catchment area. Then I'm also going to show you how do we digitalize the health facility? Okay. There is empty, if you see the third from the below, empty sites digitalized. So this, we already created a container for you to add points or distribution points. So we click that, like earlier, I click the pencil button, then good. This is not the point one. So
So as you look at the satellite image, also try to start getting familiar with what is on the table and what is on your screen. Yeah. So this where you're seeing blue buildings. Try and identify. Try and see which area you're going to work in, because once we start digitizing, whatever you have on your table, the lines, what you've physically marked, we're going to try and transfer it on the map. So you need to be familiar with also the satellite image that you're seeing on your screen right now, and also the printed one, because that's the area you're going to go and going to do those things. Yeah.
okay.
All right.
So then now, if you look at it, let's say the big ground where the building with the big ground is maybe school or something. There we can set up a distribution point. So what we'll do is we click on the top of the building and say, okay. So you added a distribution point on the map. So see, for this catchment area, you have one distribution point and one catchment area on the catchment area, and then okay. So this is how, it's simple step. So we are not teaching you how to digitize, but the process how we change from paper information, a discussion done earlier session on the digital map. Why we are doing now? Can you save? Can you save? So anyone has question? Sorry?
Which tool for adding a point rather than the polygon?
So what you need to do is you first activate this layer. Let's stop it. First, go here and click this button. If it doesn't switch, what you do is cancel for all selected layer first. And now it will go to default setting. Then what you have to do is click it. Then why it's not activating again? Yeah. So you press in this 3 dots and then what is it? Add point feature. So what you do is what you need to do is first, uncheck, then check, then cancel all layers. Cancel for selected layers or cancel for all layers. Editing setting, you can cancel for all layers. And again now click the button. Then you will see these 3 dots and a plus sign. So take that, click on that and click on the map. Saying first, so what we are doing is we are trying to add distribution point on the map based on the work that we have done and try to identify a feature from the map and put it on the exact.
Are we okay?
Yeah.
So let's turn these other ones also off. Any group which has already finished? When working with QGIS or any of this, a mouse is always very good. It's to be your best friend. So much faster when you're digitizing. Digitizing without a mouse is one hell of a job. So try and use a mouse. It's smoother, there's more control. Hmm?
So, were you in the meeting yesterday? We had a talk where there was a small mammal very important to the future survival of man. Maybe it's a mouse. Where are you based? Here. Are you involved in the malaria program? So it gets used for TB, malaria, everything. So does it get used a lot for SNC for malaria?
Again, for malaria,
It's new to you. Yeah.
that's why we really want this session.
So can we move, because we are running out of time. So can we move to second step? Quickly, can we go to second step after digitizing? So if you remember, what we said was building footprints. So now we have provided you building footprints in the same shapefile. If you click the last layer, what do you see? If you click the last layer saying building footprints, so we have already extracted buildings for you for the area. Now when you were planning, you were not sure how many buildings were there. So with a click of a button, you can count the buildings in respective catchment or sub-catchment area. So that for monitoring, you can say go to 10% of your catchment household and see the coverage. Or you see whether these are the buildings accessible or not from the health facility. Here what we are doing is trying to extract the buildings, building count. So please look at it. So if you look at it, you have this layer, the catchment area. Let's suppose this is the catchment area you digitized just now, sub-catchment area, where you already identified the distribution point. And you see how many buildings are within that particular catchment. So how we do that is very simple step. So we are now using only 2 layers. See, catchment area and building footprints. We are not letting them centroid, calculate the centroid. You want me to use that? Building footprints. Okay, that's good. Just
I can explain that. So we are using, the reason why I'm asking her to use the centroids of the building instead of the actual building footprints is because when you use, it's a polygon, yeah? So you may have a house that, as you delineate your zone or whatever, some of part of the house may be, or part of the area may be in another zone or something like this. So if you to count the buildings itself, it will not give you accurate numbers. But if you pick actual points of the building, like I'm in the middle of the building, I pick the point. So a point is more accurate because you're actually counting individually, and it's very unlikely that it will be falling in two different areas or something. That's why I specifically asked her to use the centroids instead of the footprints. These centroids are generated from the footprints. Yeah.
And just to not to panic, we have put all these slides how to calculate centroid building footprints. The steps are already in the presentation slide, which you can go later if you really want to study. But right now, for the sake of time, we are just giving you the key messages only. So see, like greens are building footprints, and then we have already created the centroid. And to calculate how many buildings like in this area, what you need to do is it's very simple, like count points in polygon. And you give polygon as a catchment area. And points, it's already selected. And here, create a file. And you can just say building count. See, like in the catchment, the green catchment area, in this green catchment area, how many buildings are there? You see number points, 4,039. So you know there are 4,000 buildings. All of them may not be residential, but at least you can, estimate, like say, okay, there are 4,000 buildings, so maybe this many, saying if it's a residential area, all may be buildings where people live. And based on your previous experience, you can calculate how many LLIN will be needed. So that is, like sitting on a table without having a knowledge of, local knowledge, you could plan that. Imagine if you are a local health worker or a district manager who is in the field and supporting the planning work, then how this tool can enhance your decision making or planning capacity. So that's what this is another set of thing. And we have, what is the time? We have till 12:30?
Yeah, we have up to 12:30. Again, one last thing as we wrap this session up, the digitizing process is very important. The digitizing process is very important because even when you're digitizing, if you don't do it correctly, the number of buildings that will be counted for each of your zones will not come out correctly, or even the software will sometimes tell you, correct your polygon doesn't look right. Yeah, it's passing over one another. So it's painful, but very necessary because it creates that environment where you're interacting with people in the field, you're actually making changes, And as I always say, what is on paper is not, what you have drawn is not really written on stone. Once you bring it there, you can still make adjustments based on, again, a review of what you have digitized. Maybe you make some changes, but now it's more in the workshop environment, you're doing it together. All right.
Okay, so we are going to okay.
Yeah, Mona will continue. I will be stepping out as I have another engagement, but I'll come back for lunch.
Thank you, Sam. Okay, so we are moving. Actually, it's until 12:30, no? The session. How long can we go? Who is the organizer?
So 12:30, yeah.
Okay, thank you. Okay, this is the last session. Here, this is advanced analysis. So what we did was mapping the reality. I'm digitalizing the ground information on the map. Now, based on this data set, we are doing further advanced geospatial analysis. So this is accessibility. So what is accessibility? Like this morning's challenges, someone mentioned about road network, rainy season, whether you can reach or this area population can be reached or not. That is accessibility. So any healthcare service coverage depends on two factors. Cannot hear? Okay. So then two things. What is it? One is access, another is availability. And another is service uptake. So even if you have access, service uptake is not there, then coverage won't be there. And if you have people willing to take the service, but access is not there, then the coverage won't be there. So for that reason, we are kind of looking at physical accessibility. So identify areas that are not accessible by certain travel time. So this is a bit of advanced analysis. For this, what you need is catchment area digitalization, distribution point digitalization, and if you are happy with the manual work, I mean the regular discussion workshop, happy with the output, then you can use those data set to do the higher level of high geospatial analysis. So here, this is also another open source tool, which is called Access Mode. So you have desktop version also, and another is web version. Both are freely available, and link is here. The desktop version is more advanced because it has advanced in the sense it has more functionalities, and web version we are still, it's on the still development. So only 2 activities or 2 analyses are available. So in terms of, to do the access mode analysis in access mode, you need to have health facility location, then health facility location, then catchment area, transportation network. So transportation network that is available online may need to be refined with support of local knowledge. I'm saying that, I'll explain you why. Then barrier to movement means that if there is water river or lake, then people cannot travel. So that is barrier for movement. Then again, we need target population. That is from model population, not from census data like admin 1 level, admin 2 level. It's more of surface raster data. Then land cover. Land cover also enhances or hinders people's travel time. So it's wooded vegetation, then it's slower, but if it's an urban area with lots of load network, it can go faster. So then finally, another important layer is DEM, is the elevation of the ground. Once we manage all these data set, then we need to have a scenario table. What does scenario table means is the travel speed. If it's main road, what is the travel speed? If it's secondary road, what will be the travel speed? If it's just a path, what will be the travel speed? So just to create the scenario, so you cannot, you don't need to stick to one scenario, you can use multiple, like the travel by motor all to the health facility, depending on the rural network. If you do not have a public transportation, then partly main road we will travel by car and public vehicle, and then partly we will travel walking. So all these scenarios can be simulated in the software. And what we will get here is travel time distribution. So mainly there will be 3 outputs from this analysis. One is gives the accessibility. The scenario is walking plus walking in other areas, but motorized in the main road. So people who is going to get the service, they travel partially by road, and then, I mean, in a vehicle, and then by the rest by walking. So then, if you look at the image on the right, maybe it's more clear. Image on the right, you can see rings like blue ring, then green ring, and then yellow and orange. So what does that mean? What do you think these will be? This is, can anyone answer? What can be this? Extent of travel time, like to health facility from the surrounding. So the blue layer means the 30 minutes travel time. Similarly, orange ring is 2 hours travel time, red more than 2 hours. So this is how analysis pops up. And the result in smaller area, it looks like this. Now you will have to, we will give you a scenario, then based on that you need to do some thinking work and then present at the end of the, I mean, not in 10 minutes, 15 minutes time. So for this, like the leftmost image is like travel time, and you can see the legend, like blue is 60 minutes travel time. What does that mean is a person lives in the blue zone, then for them to reach to the distribution point or health facility, it takes max 60 minutes travel time. Similarly, green zones, like the green, if someone lives there or buildings in that area, then it takes 60 to 120 minutes, means 1 to 2 hours time. So maximum it's 2 hours time. Similarly, the color gets darker and travel time is more and more. So when you were doing this morning the exercise, that which area is far, how long will it take? This particular analysis will support you to say, okay, hey, the orange areas or maroon areas, you may need to think about some other distribution centers so that the people from there can get access to the services. And the center image, what does the center image says? It shows you are demarcating sub-catchment area or catchment area, whatever it is. Like, based on this layer, how many or proportion of population that are covered within 20 minutes travel time, or 30 minutes travel time, or 50 minutes travel time. So once you have all these data ready and fit into the system, the access mode, it automatically generates the information for you. And you see, now you see like it's 2 hours, let's say it's 2 hours travel time. Like if the proportion of population reach, if you consider travel time is 2 hours, then you see the 4 red sub-catchment. These have less access compared to the yellow and the green ones. Green, like 80% of the population have access to health care services or health facility within 2 hours travel time. But here the red ones, this takes longer. So the table also explains the same. Like if you look at 1, 2, 3, fourth from the bottom, you have 69% of the population need to travel more than 2 hours time to get the healthcare services. Hey, we need to do something here. Like doing the micro-planning also, this can be another layer of information to distribute your, to plan your distribution site. So this was a quick, overview of what is accessibility. It's too much for everyone because we started doing the entire 5 months work in 2 hours. So this is what the process is. Now, first is prioritize, prepare map, discuss, digitalize, then use another advanced analysis and use this in your planning activity. So that is actually overall microplan. Now here comes, we have about 15 minutes, 20 minutes. Now please form the group again. Regroup once again. We will have 10 minutes. We will give you, I will project. Okay, so this is actual microplanning activity. mock, not actual. So you are given, based on the satellite-derived information that we did from day to day, from the morning, like number of health facility in these 17 catchment area, number of building structure, we already did it. Then total population from world pop for the catchment area. This is actual data. And then the last column is accessibility status in individual catchment. Now, the work is like, so these are all satellite-derived or GIS-based analysis. And then, what should be best strategy to reach maximum number of population in LLI distribution campaign? So it's the same this morning's exercise. Now you have more information in your hand. Estimate, how many LLIN or need for the area, or calculate storage, if you really want to do the calculate storage requirement for that many LLINs, you can calculate, and I don't think we have that much time, and then you can look at whether any catchment area need additional distribution sites. You can use map plus this one, and see, and then also the final question is geo-enablement. Does it complement the conventional way of planning or not? So we have 10 minutes. So quickly, we can discuss it among the group and present, I mean talk about, not present, but talk about it. We will have 5 minutes. So now your time starts. So 10 minutes. With this, our session ends, but we need to present this we end the session. So 10 more minutes. No, just to, like, what we wanted to show you the concept, like you are doing conventional microplanning, and what satellite derived or geo enablement gives additional benefit to your work, whether it gives or it doesn't give. So just to create a thinking process, does it really help you? Because before you will sit in the table and say, okay, my area, I have around 6,000 households, and maybe I need to divide 1,000, let's say, 1,000 people area, or catchment area with 1,000 households, and add one distribution point, and then maybe distribute the LLIN for 10 days. I mean, that you do. But with the geo-enablement, you have some additional information. Then how do you use it? So just to, like, 10 minutes, H table A, B, C, D, E. And one can volunteer to present for, yes. Are you ready to present? Should, any group would like, which group wants to volunteer? So our time is almost finishing. So which group would like to volunteer? So no group? Can I call? Can you volunteer? Group D?
Could you give us 5 more minutes?
Okay, sure. So we have 5 more minutes. So could you please this exercise, so maybe one group to respond to this.
Okay, I can respond.
Give us 5. Let them. Yeah, and let them finish. Then we start.
I would have volunteered, but I don't feel the right one here.
Yeah. So, are we ready? Are we ready for the answer? So this group can volunteer to respond?
We're still...
So you need 5 more minutes. Okay. So, are you ready? Yes? So we start with this group then. Okay.
No, sorry, we've been working on the stuff from earlier because it was so rapid and bringing everyone up to speed.
Yeah, that's good. That's
Yeah.
good. So what about this answer?
Well, we've been working on this.
Okay.
So we haven't.
Okay.
We've got to consolidate the skills we learned in the first half of the session.
So we have volunteer from this group. So maybe everyone is working, so let's start with you.
Okay. I just was going to make comment about what our group discussed. So obviously it would depend on resources and ability, but assuming that we don't have any more resources than we've already used, in the worst case scenario, we're going to have to do some shuffling. So there's sort of two options. One of the thoughts was that we want to prioritize the population that needs to travel more than 2 hours. So we looked at I'll use the numbers on the left, but number 17, Simba, and number 6, Abebe, both have over 50% that need to travel more than 2 hours. So we felt like they would likely need to have another distribution point. And there are sort of two options. We could either cancel a distribution site that doesn't seem needed or reduce the number of distribution sites in an area that maybe doesn't need it as much. So if we look at number 2, Amina, they have 8 distribution sites and 0% that need to travel more than 2 hours. So our thought was we could take one of the distribution sites from Amina and add it to Abebe to reduce that 69%, since that seems to be a population that is really in need of having more access. We're obviously taking into account population as well, so maybe number 10 at the top, Achiang has only 16,000 people, opposed to some of the others that have hundreds of thousands, and they have an 8% that need to walk to more than 2 hours. So if we needed to cancel one site, that might be an option. So that's what our group discussed. Thank you. Explain how geo-enablement complements conventional microplanning. If you don't have resources to maybe be able to walk to every place and count the number of houses, this has enabled us to really see an area catchment more easily, and with less resources, be able to summarize where those catchment areas are and the number of people within them. So, thank you.
Yes, thank you. Now, 5 minutes.
Okay, I don't think we are ready yet, but I can try, and I would look forward to our team to help me. No. Do we need more time, or let's just go ahead? Okay. So looking at the first question on the best strategy to reach the maximum number of the population in the different locations. So we had 3 ideas. So we looked at the percentage population that need to travel for more than 2 hours. So where we have 0, 0, 0, 0, we can use like distribution point that have already been planned. Assume that is 1. Now, where we have 8%, 4%, 5%, 6%, 11 and 13%, that's less than 20%, we are saying that we are going to use 2 strategies in that location. That means we're going to have a fixed point, and we would also then have like an outreach where we would just have that point to now go to the population that, because it's just about 8% or 4%. Now, when we have more than 20%, for each of 20%, we want to add a distribution point. So if we look at line 16, where we have a 40%, that means we will be adding 2 distribution points, right? And each distribution point is 20% of that population that will be covered. Good. So in the context of strategy, that's what we agreed. For the hills, for the area, oh, okay, great. So we can skip that. Storage requirement, I think we can skip that. 100 bills, about 22-something square meters. For catchment areas that need additional distribution sites, and that is what I just explained now. So for each of the 20%, then we are going to have that. Then the final one, explain how geo-enablement complements conventional microplanning. Should I be realistic? Okay, please don't crucify me, and these opinions are just mine. As of today, this is still very difficult to achieve for 4 reasons. First is the capacity that is needed. So now, if we have to do this, we need to do this at the sub-district level. So that means you need to have people being trained with GIS scale to go out and, and then they sit down with the maps and they do all of this. Now, 2, I think you had a slide on slide 32 with the list of information that need to be received before the microplanning can even happen this way. So that means in the context of costing, we will have to spend more money to send people out to the field and get the geo-coordinates of the health facilities and bring them back and help us to analyze and get our data points. That is increasing cost, and we all know what's happening right now in our ecosystem. Now, 3 is in the context of the reuse of the opportunity. So, if governments are speaking to themselves, if the EPI program is speaking to malaria and so on, then I don't think we'll have this problem as such. But in some countries, you have a lot of siloed engagements, and it makes it difficult to just do this once and reuse it for other programs. So, that means that you have to keep doing it and increasing the cost with this campaign. And I think my final recommendation on this will be, we see, okay, how do you see a future where we can use like AI and machine learning to just, import this data, all right, because we have data from previous campaigns, and an AI can help us, look at the satellite imagery and help us to come up with something, all right, and then we can just print it out, and then, we look at it, and if we need to make adjustments, we make adjustments based on the reality, and we adjust what we have on the platform, and it's done. So I think we need to cultivate a new approach around the thinking around this. So let me just pass it to my colleagues to share their thoughts as well. So.
Okay, so I'll just take on point 4. For me, I think that the difficulty we have in terms of having to send people out to go get those information, those geo-coordinates, it's about the coordinated way we implement systems, right? And I still think that we still need to put a structure around it because we have a lot of this data, right, sitting, but we don't continuously use them. So if I'm implementing my own program, I could send people out, they collect the coordinates, I use it, another program comes, goes, does the same thing. So there is no building up on data, right? And so if we build up on the data that we have, assuming we went before and get this data, we can estimate a period of time to go back to do that data collection, and it still fits into the overall data. So what I realized with this is good, really good, but at the end of it, it rests on our data that we collect, and also rests on the structure we build around the way we collect our data. Because if we create a structure around data reuse, right? So I could simply, like she said, it will reduce the time. But I also get his concern, because at some countries, data are collected at different places and they're not talking to themselves, right?